You do feel like you're a freak show. The bearded lady, it's me. I have excess facial hair. It's been a week midday since I last had a shave.
Do you think it's getting worse?
Definitely. Give it a little push. Whee!
Lovely. I'm just waiting on that report for that patient's patch test. Oh, it's here. Thank you.
My name is Arya. I'm 27 years old and I'm from Perth in Scotland. I'd say probably about 50% of my waking hours I'm thinking about my facial hair, how to get rid of it, how to mask it, when's it going to come back. I came out as a gay male when I was about 19, and that was sort of first step into my gender exploration. So it's nearly 5 years ago now that I decided to live full-time as Arya. I worry about my facial hair. The more that I shave, the thicker it comes back. So it's like I'm constantly fighting a losing battle. When I go into shaving, I start off feeling masculine. And when I finish, I feel much more feminine. When I can run my hand across my face without the sound, I'm happy.
When Arya doesn't feel that she has perfect skin, she'll hide away.
I would never go out without shaving. It causes me a lot of dysphoria. I feel like people can see the truth.
She isn't Miss Sass that she is normally when she feels that she has perfect skin. That upsets me because I just want her to be happy.
So it's taken me about 2 hours from shaving to this, to completion. If I was to have treatment for my facial hair, it would be life-changing. That's the best way that I could describe it.
Hello, 152 Harley Street.
Hi there, Arya.
Hi there.
Hi, I'm Emma Craythorne.
Nice to meet you.
Come with me.
No problem. Okey-dokey.
And just have a seat on here. They're really heavy, those chairs.
I know.
Aren't they? Yeah, that's the weightlifting. Perfect. So, Arya, how can I help you?
I'm here today because I have excess facial hair from obviously being a transgender woman. It's something that really affects me every day. Even though there's makeup covering it, I can still feel it.
So you're really, really conscious of that as soon as you start to feel it or see it or catch it in a mirror or something like that?
I won't go out of the house unless it's gone or covered up, even just to nip to the shops, and I live 5 minutes away from Tesco's.
Yeah. When we do hair removal, it's not actually considered permanent. However, it really pretty much is. You know, in 85% of cases when we do hair removal, that's it cleared for 5 years. So it's pretty effective, particularly on dark hair and white skin. It's important for the time that we're doing it that you were careful in the sunshine, not tanned and not fake tanned in that area.
Oops.
We all love a good fake tan. As dermatologists, I love a fake tan. That's the best type of tan. The course is 6 treatments.
Okay.
And they're spaced 6 weeks apart. And we'll be able to get on and hopefully start one of the treatments today.
Sounds great.
Okay, so the next patient is going to be laser. If we put the blinds down and signs on the door, okay? Yep. So the laser we're going to use works by targeting and heating up the hair shaft. That heating up of the hair shaft damages the follicle of which the hair is coming out of, and it means then that the little hair bulb there dies and it doesn't regrow.
And we got some goggles here. All right, so that's going straight to your eyes. How is that?
That's good.
Amazing.
Right, I'm going for a nap.
Yeah, you can go for that. We're going to pop some gel on the skin here.
Oh, that feels good.
It does feel nice, this gel, doesn't it? Everybody's going to have to put their goggles on. Okay, I'm just going to touch the edge of this, okay? And you'll just feel a 1, 2, 3. How did that feel?
That was all right. No pain, no gain?
Good. Doing good. You might just feel a little bit more, a bit stronger in places. You felt that a little bit stronger. Yeah. Okay, so you might feel a little bit stronger again. How was that? Okay? These ones are just a bit stronger, aren't they? Just where you have the more hair, you notice it a little bit stronger.
Just here.
Exactly.
Yeah.
And turn your wee head over to the side for me a bit. That's very good. I'm just going to do one more just across the middle. Well done. Very good.
It just feels like an elastic band being hung at your face.
Do you know, that's exactly what I tell people. It feels like an elastic band hitting off your skin. And you can probably smell the fact that the hair's burnt a little bit with it.
Just a wee bit.
Just a wee bit, good. Although we can remove the hair follicles by the laser energy heating them up, the hormonal drive is still there. So it's almost a combination of the two things that you have to do. You have to get rid of the hair that's already there, but also you have to try and keep the hair away, and that's with the hormones, because if we did all the laser hair removal and got it all clear and you weren't on hormones, then it'll just eventually find its way back, probably, yeah.
I feel over the moon. She's put me totally at ease. I've obviously just had my first session and it was nowhere near as scary as I thought it was going to be. This is really going to change my life, I can tell.
I don't feel confident walking down the street because I'm worried what people are going to say. It breaks my heart because people can be cruel and they just think that they have a right to say something, and they don't. My condition is excess facial hair, as you can see. It's really bad around my top lip. Within the last 5 years, it's gone round my chin and down my neck. If I don't do anything, it grows into like a goatee within a week. Firstly was my top lip. That was when I was in puberty. So when I was at school, I used to get very badly bullied about it. Really affected my self-confidence and my self-esteem. My very first term, I went to my head of year saying that I've been bullied, and she made me stand up in front of everyone else, then went around asking if they thought that they were better looking than me. And I was pleading with her to stop, and she just carried on. It affects me to this day. So yeah, my self-confidence is at rock bottom. I've tried electrolysis, waxing. I've been given a prescription hair removal cream, and it didn't work. I think she sees herself as less than a person because of this. She feels that there is something drastically wrong to have excess hair like she has. I'm currently single, not been in a long-term relationship for a number of years. My friends are aware of it, and they know it can affect how it affects my self-esteem. I'm nervous about meeting Dr. Emma. I don't want to, oh, you just have to deal with it. I want someone to give me some ideas on how to treat it. That's what I want.
Hi, Caroline.
Yes.
Hi, nice to meet you. I'm Dr. Emma. Come with me. There we go. Come on in.
Hi, Caroline.
Hello. And just have a seat for me. What have you come along with today?
I've come in about the excess facial hair that I have.
When did this all start?
It started puberty on my lip. It's got worse, and over the last 5 years, it's started going down around here.
I can see it's upsetting for you to talk about.
Yeah.
I'm sorry about that.
It's hard, because I've had comments from people in the streets. I've had comments from people that I went to school with. I was bullied because of it, so...
Oh, I'm really sorry to hear that. I think people really underestimate the effect that having excess hair can have.
Yeah, definitely.
Oh, and you've not had any help with it?
I saw a specialist when I was a teenager, and I was basically told, it's hormonal, you just have to deal with it. It's fine. I saw an endocrine specialist, and that's when I was diagnosed with polycystic ovary syndrome. They also said that I had too much testosterone in my body.
So when was the last time you saw one of the endocrine specialists then?
That's been 15 years.
Oh, it's a long time.
So, yeah.
You've managed this all by yourself then for the last 15 years?
Pretty much, yeah.
Caroline has hirsutism, which is extra thick hair growing on the arms, on the legs, on the chest, on the lower face, on the upper lip. Underlying that, she has a condition called polycystic ovarian syndrome, and it's very common. You know, it can affect up to about 10% of women, and this presents with things such as acne, irregular periods, difficulty in becoming pregnant. And in Caroline's particular case, because you have too many of this group of testosterone hormones, then it stimulates the hair follicles that would just be asleep. And how long have you left this for me to see today?
This is just over a week.
Okay. What about, are you married, children?
No, I joined a dating agency and took my name off within 24 hours because I was too self-conscious about this.
What would you hope could happen?
If you could help manage the symptoms, reduce them, that would be great.
First of all, I want to have a close-up look and see the skin of your face. Is that okay? Yeah. We're just going to start up here where you've got this excess kind of hair growth. And this is where the hormones have told those hair follicles to turn it from the downy hair into the thick hair, the terminal hair. And it comes round here and it's right over the top lip and then right down under the chin. I just want to see what the rest of your skin is like, because the hormones can have an effect on how we make the rest of our skin too. You'll notice probably when you run your hand across here that the skin is a little bit bumpy and a wee bit dry in places.
Yeah.
What you've actually got is a little bit of the extra sebum being produced and then a reaction to that. I'm just going to check through your scalp to see if it's in your scalp as well. Yeah, you've got a lot of that in your scalp. So sebum is just the product that's made by our sebaceous glands. It's actually very, very moisturising. But the problem is when we make too much of it, it can sit on the skin surface and then yeasts that live on our skin love it and feast on it and then multiply. And this is over the eyebrows as well. Okie dokie. I definitely will be able to help you.
Brilliant, thank you.
And I am really excited to be able to help you, because I think that it will make a big difference just to how you feel and view yourself and put those horrible worrying years behind you and go, right, the beginning.
That's what I want.
Let's start with the hair, because that's why you first came. The wonderful thing about it is the hair is dark and your skin color is white. And that real difference make it very easy for my laser to pick up the hair follicles and destroy them. In normal circumstances, we would say that we're able to reduce the hair by 85%.
That would be marvellous.
You're going to be slightly trickier because of the hormone side of things, but I think that you're going to benefit from seeing one of my colleagues who specialises in endocrinology to try and change around some of the medications that you're taking so that that will then complement my laser treatment.
Okay.
One of the specialists here in dealing with people with hormone disorders. He will see her and then give us suggestions on how we can manage this hormone imbalance in a chemical way. And then lastly, I want to give you some topical treatments that you'll do yourself at home just to help out the skin. This is going to be a number of different treatments, but we can get rid of this hair. Crying happy?
Yeah. Thank you.
My pleasure. This skin condition has really, it's just taken over her whole life. And, you know, we can fix that.
Looking forward to, obviously, trying the treatment. I do feel that having the consultation with Dr. Emma has given me hope that in the not too distant future I'll be able to walk down the streets with my head held high. I started treatment about 3 months ago. Really excited to show Dr. Emma the results, and I'm hoping she'll be pleased as well.
Hi, Caroline.
Hiya.
You look very different.
Thank you.
Come with me. Now, where is Caroline? Who is this glamorous lady in front of me?
Thank you.
What a difference and a transformation.
Yeah, it's worked so well. I'm feeling much more confident. People at work are noticing that I'm more confident. Family are noticing it. I'm walking more confidently. I'm giving people more eye contact. So, yeah, I'm really feeling good.
I can't wait to get in and have a look, but from here, what I can see most strikingly is the glow of your skin for a start.
Well, I've been following your orders.
So we're now at 3 months since I first met you,
Yeah.
and you have been put on these hormonal medications, and they are testosterone blockers as such.
Yeah, I noticed a difference straight away after the first dose had finished. When the hair was coming back, it was a lot less darker than it was. It's not as coarse as it was. So, yeah, I noticed the difference.
Okay, I want to stroke those cheeks that look so smooth. Is that okay?
Yeah, no, it's fine.
Good. Okay, do you want to pop your glasses off for me? So, okay, let's have a little look. So first of all, there's a big reduction, certainly in the cheeks. That's a big, big improvement. That's lovely. Skin looks really nice. My goodness, the forehead, which is now completely clear. It was all in the eyebrows, and that's all completely clear too. That is brilliant. Great. I think that we just have to carry on with this approach. I'm looking at about another maybe 4 or 5 treatments, and then hopefully the hairs will be gone.
The past is that way. My future's that way. And because of your treatments, I'm feeling like the future's a step closer to me.
Well, it is, and you're heading exactly that way. I'm gonna cry. Don't.
Well, I'm grateful for everything that you've done. You're changing my life.
Oh, well, you are, Caroline. You're changing your own life.
With your help.
You do feel like you're a freak show, you know. I looked in the mirror this morning and I really was just so close to crying because I just thought, this looks horrible. Got to that point now where I don't know what to do. The problem that I have is excess facial hair. It's just got to the point where, unless I'm shaving it every day, it's so obvious it's there. It is disgusting. The bearded lady, it's me. You do feel like you're a freak show. Disabled, hairy lady, come and stare at her. That's how it makes me feel. I live with my partner, Sean. I met him online, so he got to know me as a person before the issue with the facial hair, because obviously when you've got your profile picture, you can angle your camera and there's little tricks to make you look better and all that lot, so I didn't catfish him too much.
You want a drink?
Oh, yes, please, babe. Can I have a coffee, please?
Coffee, yeah, okay.
Yeah. I was born with brittle bones disease. If I fell over, I would pretty much be guaranteed to break a leg or an arm. But as a result of all the breaks that I had growing up, I've now got really bad osteoarthritis, so hence the wheelchair.
Hello.
Hello, you ready?
Yeah, you all right?
Yeah, hello, Meg.
Meg, in.
I've known Kim all of her life, and nowadays we're dancing together.
Having the disability meant that people would look at me and I didn't like it.
Which way are you going?
I don't know.
It's took me a fair bit of time to get her to come to dance. Now she loves her dancing, but because the hair is getting thicker, there is a very big chance that she will stop going because she won't want people staring at her.
I've learnt to accept the disability. I'm quite happy with me, apart from this facial hair. This morning, I'm going to see Dr. Emma. It's been a week and a day since I last had a shave, and it's driving me up the wall. It's really, really itchy. If it means that Dr. Emma can see it at its worst, then I'm doing it for her. Hiya, I'm here to see Dr. Emma.
Hi, Kim.
Hiya.
Hi, nice
You
to
all
meet you.
right?
I'm Dr. Emma. Come with me.
Hiya.
So tell me, what's been happening with your skin?
So I've come to see you about my facial hair. I've seen a couple of doctors, and they said it was more of a cosmetic thing than a medical thing. So they just told me to get on with it, basically.
And how did that make you feel?
I was pretty upset because I like to think of myself as a feminine person.
Yeah.
And having this makes me feel in the least bit feminine.
And do you think it's getting worse?
Yeah, definitely. It just feels like it's a constant battle to make it look less obvious to people. And in the back of my mind, wherever I go and whoever I talk to, I'm like, are they looking at me or are they looking at my chin? I never am not thinking about it. It's always there in my mind.
How at the minute are you removing the hair?
I shave it. I've tried waxing it, I've tried hair removal creams, and nothing seems to really get rid of it.
And how often do you have to shave it?
So usually I'd shave it every day. It's the first thing I do. I get up, I go to the toilet, brush my teeth, have a shave.
Okay. What I want to do is have a close-up look at your skin as well, if that's okay.
Yeah.
We're just starting to see these thickened terminal hairs. So in most cases, everybody's got the hairs, but they tend to be like the little baby hairs,
like
very
peach
fine
fuzz,
hairs.
as they call
That's
it.
exactly right. And you can even see it a little bit here, you know, kind of where the sideburns would be.
Yeah.
But then as we move down, it just gets really dense, doesn't it?
Yeah.
Underneath the chin. The front part of the chin is quite spared. And then we've got it coming all the way around here. Okay. It's interesting, isn't it? It's just in this area. So this is a diagnosis of something called hirsutism, where you have excess hair that is thickened hair or terminal hair growing in an area that you wouldn't normally expect to find. So in your case, it's hair growing essentially in a male distribution area, and you're a female.
And do you know why it happens in some people like myself and then not in others?
Sometimes that can be because the hormones there's too many of them.
Yeah.
Or sometimes it can be that the hormones are completely normal, but the hair follicles themselves are more sensitive to the normal circulating volumes of the hormones. But undoubtedly, I mean, this is probably one of the most rewarding things that we can do as laser dermatologists, is to remove the hair that's on your face using a laser.
Wow.
And usually, for 6 treatments, spaced 6 weeks apart for your skin type, we should be able to get an 85% reduction in the hair that you have on the face, which I think would be pretty life-changing for you.
Yeah, definitely. Any improvement would be nice. So 85%'s like, wow. I felt like a weight had been lifted off my shoulders. Yes, there is condition, and yes, there is something that can be done about it. Just finding that out is amazing. I'm just so happy.
How'd you go?
It got on really, really well. There's light at the end of the tunnel.
Okay, no problems. We'll see you later. Bye. Oh, Kim's coming in today.
Oh, I can't wait to see her.
Yeah, I know.
She always has her hair so beautiful in all these different colours. She's like a lovely unicorn or something. I wonder how she's getting on.
I'm very excited to see Dr. Emma and the team, see what she's got to say. Hi, I'm here to see Dr. Emma.
This takes it.
Thank you. I'm feeling a lot more positive. Hopefully she's pleased with progress.
morning, Kim. Well, it's lovely to see you back.
It's nice to see you as well.
From here, there is such a difference.
Huge difference.
Huge difference. Like, look at the quality of your skin. It looks beautiful.
It's a lot clearer.
Can I get in and have a look? Is that okay?
Sure.
Right, let's have a look. Oh my goodness me.
Just like, yeah, amazing.
I thought I was going to see everything when I got up close, but there's
not a lot there to see.
Look at this cheek, it's amazing. Fabulous. Onto the chin, this is where we've got always
That's the
this little
worst
circle
bit,
and
isn't
little
it?
list. They're always
either
the last.
side. It's weird.
It's in everybody. That's what happens in everyone.
Ah, okay.
And then underneath, that's clearing away nicely.
Yeah.
Again, this cheek's lovely. I mean, your skin just feels so much smoother, doesn't it, all over? The rest of the skin is looking excellent. I mean, that's just brilliant, isn't
Amazing.
it? This is really, really transformed, hasn't it?
Yes, definitely.
How does it feel for you?
It feels amazing. Like, I keep going, oh, I feel so smooth. Like, it's completely changed already, even though we're only halfway through.
That is so good because, you know, 3 treatments in, as much of a difference as this is really good.
Exactly, yeah. I mean, I'm just over the moon that we could get to the point where we're at now. Like, it's been really, really good. And I've had loads of people commenting saying, well, you look really well. And I'm like, I know. Look good.
Does it make you feel a bit more excited for the future?
Yeah, definitely, yeah. I'm not quite so nervous about being more social and things like that as well, so that's really good.
It really is one of the most rewarding things you can do as a dermatologist. I'm really, really pleased for you.
I'm really pleased as well.